Hello, good afternoon, Rancho Family Medical Group. My name is Steven, and I am here with Dustin with Basal Nutrition, and wanted to introduce you to this new partnership we have. So, Dustin, tell me a little bit about yourself. Tell me about your group. Where are you from, and how'd you get started?
Okay, awesome. Yeah, so I grew up in Orange County, California, not too far away, and I kind of lived all over the place. I was in the Navy for about 5 years, working as a dietitian. In active duty, so I bounced around a little bit, but I ended up back in San Diego and then relocated here to beautiful Temecula. I've been a dietitian for about 10 years now, have about 15 years of ongoing education and training in nutrition and public health, and my whole mission really with Basal Nutrition is just to make nutrition education and support easy and affordable.
So what got you to here? Why nutrition in the first place?
What really got me into nutrition was growing up, I saw a lot of the negative effects that nutrition and lifestyle choices can have on family members. And it's just always been an interest of mine of how that could be kind of intervened. Like, how can we mitigate those negative effects of life, right? Like, sometimes nutrition is complicated, and it's something that we really need to take a look at as a priority in our life, but we have so much going on that it sometimes takes that back seat. I'm doing something that matters, and that's really important to me.
So that's perfect, because that's where this kind of partnership came from, is you are an insurance-based, which means there's not these high out-of-pocket costs for people that want to see you. How does that work? If someone's watching this and they're interested, how do they qualify for this? How would that work?
Definitely. Nutrition is a process that can be a little bit challenging when you're out in the community setting. So two main barriers to care with nutrition education are high out-of-pocket costs and getting insurance to cover that cost. And this typically results in people just not seeking the care that they need. So with Basal Nutrition and Rancho Family Medical partnering together, this really eliminates those two barriers completely and makes it easy to work with a community dietitian who is here to support your health goals. Diet kind of implies like a short-term intervention, right? Like, we're gonna get down, we're gonna meet our diet goals and we're done. But in reality, diet's forever. It's a long-term approach, and sustainability is a big one there too. I can help sit down with you and develop that plan where it's a tailored approach toward nutrition, and it's really based on your needs and goals. And it's not just a one-size-fits-all approach. And I'm here for continuous follow-up too. So if one thing doesn't work, it's not an end-all be-all. We can continue to build upon other approaches and, again, find out what works for that person.
So if I'm a patient and I'm interested in these services, I would talk to my Rancho provider, and they'll either promote you or we can bring it up to the doctor, and they're gonna write a referral to you, right? And then I can come in this space. I know you do telehealth. And then you'll set up a certain number of appointments, and what are some of the things that I'll get? Like, why is this going to be beneficial to me to be here?
So what I do as a dietitian is I take a lot of this complicated nutrition information and try and translate it into easier, understandable information that really helps an individual. And I use different methods of approach to really engaging and building upon education base. And I have a lot of hands-on tools. So different approaches are one skill that I bring to the table here. I have a lot of experience working with different people across different areas of nutrition. I've worked in the ICUs with very, high acuity and really high nutrition concerns. But I've also worked in the community setting where I've worked with diabetes management and also kidney care in the renal setting for dialysis. So I understand how difficult nutrition management can be when you have one more thing making it that much harder. So my goal is to really, be that support tool to help you understand and navigate through all this complicated material that you may be able to find online or through even providers, and really make it understandable for you. And nutrition is not one size fits all, really. It really depends on the person's learning style, their goals, and just where they are as far as nutrition and their total education.
So basically, if you're watching this video, this is something that is completely free to you. There's no copays when you get here. There's no additional insurance costs. And you're going to get to meet with Dustin a couple of times, depending on kind of where the need is. And you can help with all of those different areas. That's kind of would be the next steps for you. If this is something you're interested in, and I just can't recommend it more, spending time here with Dustin, is to reach out to your provider. And if they don't suggest it for you, I would bring this up and just say, this is something I want to do. They'll refer you over here, and his doors are open. He's ready to see you. So I think that would be a really great opportunity for you, the patients, and the community in general.
Definitely. And my doors are open. I offer telehealth, I offer in-person one-on-one sessions and group sessions as well. So come see me at Basal Nutrition and let me help you build a foundation of health together.